My name is Dr. Ben Amodu, a fellow of the Pharmaceutical Society of Nigeria, a fellow of Alternative and Complementary Medicine, recognized by Nigeria Medical Council. I'm currently the Director Adjunct in charge, National Institute of Natural Medicine, University of Abuja, and I am a lead phytomedicine researcher with Alamin Herbals. The moment I graduated from ABU, having studied industrial pharmacy and haven't made up my mind to synthetically manufacture my own medicine. But towards the tail end of my graduating in the 80s, WHO started talking about herbal medicine. And from there, I gradually changed to be a fan of herbal medicine. Up to the time I became the pharmacist in charge of State House Clinic, the Nigerian president's own clinic, which I was there for a number of years. And HIV/AIDS broke out, and I was not interested, based on the oath I took from ABU, that medicines that have more side effects should not be used where their cost benefits are not comparable in terms of comparing the side effect and the use to which it can be put into medically. AZT that was introduced to us then was in this group, that the side effects were more than the useful effect. To that extent, even though it was authorized by government, I was not interested in the use of it. I preferred natural medicine, and that's why I was encouraged by the words and works of Elizabeth Kaparu, which says for every infectious diseases, there are herbal remedies for them. This I took, encouraged by a German scientific work on salad combination, which he claimed could cure HIV/AIDS. And that is how I made my antiretroviral of entirely herbal nature. And to the glory of God today, it is able to resolve HIV/AIDS. To the glory of God, it resolves HIV/AIDS. To the glory of God, it resolved, for which about 140 professors have applied based on the works they have done for TED Fund, and we are the only ones selected to the same glory of God. We use basically food items. My research are into food. As I said, I'm a lead phytomedicine researcher, phytomedicine in particular from food we eat as Nigerians and as Africans. The chemicals that are contained in them, like steroid, like saponins, like complex carbohydrates, vitamin E, vitamin C, vitamin U, which is a specific cure for ulcer. Then you talk about stanins, you talk about celerium, you talk about vitamin C, vitamin D. All these things come from this food we eat, with far-reaching antimicrobial, antifungal, antibacterial, anti-inflammatory, pain relieving, infection killing, and what have you. And it will interest you that our food combination for the treatment and cure of throat cancer, which we claim is a natural substance that can prevent COVID-19, was analyzed in the Institute of Virology at the Jos VOM here, close to Jos. And it was found to be highly sensitive to Streptococcus pyogen. Is that not incredible? That a natural product could be that sensitive. And it was applied on coccidiosis, which is an animal disease found in fowls. And it cured it one hand. Coccidiosis. It cured it one hand. And I've always said during interview sessions like this, that for infectious diseases, herbal medicine is to the rescue, and I maintain it, using food medicines to cure, to prevent and cure various diseases. So far, human beings have various makeup. Human beings have various ways of reacting to situations. So far, medicine recognizes idiosyncrasies. To the best of our ability, apart from idiosyncrasies, there are no clear-cut side effects of these products. They are well tolerated, even in animal experiment and in the human use. And you should note also that medicine is now one medicine. The same medicine that is used in animal is used in human beings. So it's one medicine now. So there's no segregation in terms of medicine. So we cannot say there are no side effects. It's just the immune adjustment, which varies from one patient to the other. Their body immune system adjusts even though they are food material. This is the first time it's entering their body. So there is some little adjustment for some people. For some other people, there are no adjustment. Apart from that, there are no side effects.
Okay.
They are all over. They are all over in the world. In the US, in the UK, everywhere they are there. To be specific, American scientists visited me here in my lab in 2015 and removed 5 of my anti-cancer products, and they were taken to the state of Texas for analysis under experimental biology 2015. The first to be analyzed is called SAPFAT6. SAPFAT6 was specifically analyzed here in the Nigerian Institute of Pharmaceutical Research and Development and was found to have anti-cancer activities. But when it was taken to Texas, it was the first to be tested against cancer of the colon and was found to have 89%. While carrying out the test, they saw that it could also go for cancer of the lungs, which the experiment was done pari passu, and 89% was still obtained for the lung cancer. And today, to the glory of God, we have been using this for the purposes of curing asthma, which has no cure anywhere in the world because of the effect of this product on cancer of the lungs. So these are the positive things that comes out of plant medicine that modern medicine cannot compare with. As you can hear, they were using it to test for cancer of the colon, and they saw that it could cure cancer of the lungs. And we have used this combination, as I speak with you, to melt the prostate, to stop cancer of the lungs, to stop breast cancer, and all manners of cancers. And you can see that these cancers are interrelated. So it will not be surprising that, as a matter of fact, because herbal medicines, we use combo, the concept of combo, the concept of combinations. And these combinations, there's nothing that can stand on their way. They can bulldoze and cure a number of diseases. Because of the...
Taking care of or to reduce the...
That's a good question. Because, as I've said earlier, science recognizes individual differences. And because of that, the cancer treatment will vary from one patient to the other based on these differences that is recognized by science. But for prostate, 2 months, 3 months, depending on the PSA. The PSA is the amount of specific prostate antigen that is in the person's blood based on tests conducted. So it will vary. For instance, we cure someone that has a PSA of 386, was brought to 0.04. This is a feat anywhere in the world. As a matter of fact, the hospital where the doctor first discovered this PSA of 386 was shocked beyond reasonable doubt when he got a result from us showing that the person's prostate is now 0.04. And he started recommending patients to us because seeing is believing. Evidence is the end of argument. So, For breast cancer is a very, very stubborn cancer, some 6 months, and even for some, I advocate that they treat for 1 year so that the cancer is completely dealt with. For other cancers, they vary between 4 to 5 to 6 months, depending on the person's body makeup, depending on the body's immune system. You know, immune system is... Yes, in terms of attitude, that's a good question. You know, before now, our area of research is communicable and non-communicable diseases. As you are well aware, communicable disease has to do with people's style, you know, the style, what they are used to doing, what they enjoy doing and all that. People see women, they don't know them well, they go out with them, they end up having HIV, hepatitis A, B, C, D, E, tuberculosis, Ebola, Zika, Lassa, what have you. We tell them to reduce their intake of salt, reduce intake of red meat, in particular from cow meat, do a lot of exercise, increase their intake of water, increase their intake of fruits and vegetables, and have limited exercise, and don't allow their weight to vary, because weight is a major issue in the cause of many illnesses, weight. And before now, non-communicable diseases like high blood pressure and diabetes are known not to have cure. But having done this extensively, we have found that they could be cured if there are lifestyle modifications, like I've said, less salt intake, less red meat intake, a lot of water, a lot of vegetable, a lot of fruits, limited exercise, weight is not allowed to vary, and then balanced diet. You are good to go. Within 6 months of use for high BP or diabetics, you get a patient having his BP or his sugar fluctuating within normal with those lifestyle observations. So BP and sugar can be tamed to the extent of cure. Once the blood pressure and sugar are maintained within normal, what name do you call that? Or since they are a fluctuating phenomenon, they fluctuate within normal, and then the complications are blocked, because the complications are the major issue, that you will develop neuropathy for diabetics, you will develop eye diseases, cataract or glaucoma, which this drug has the capacity to stop and correct them and reduce glaucoma back to normal of 12, and then clear the cataract. Then the sugar level is maintained. It fluctuates within the normal, and it does not cause those side effects like neuropathy and co that I said, and that cataract and other eye diseases that I also spoke about, or the generalized pain, which they normally suffer from, or the dysfunctional erection, which this combination also corrects.
You know, Emilio must go for test.
Well, you know, for women, they are advised to do their breast pipe smear from time to time, so as to detect early and treat and handle issues of breast cancer. For men, the one that is of utmost importance, that is always occurring, mostly has to do with prostate as we age to 40 and beyond. And the early signs of them are the number of times you wake up in the night to urinate. If your waking time has become very frequent and all that, to up to 3 to 4 times, you should go and do your PSA to check your prostate, so that you know that they are within the normal of 0 to 4. Or otherwise, you now go for treatment. Then your physical activities is encouraged, especially for prostate. You have to do a lot of walks and all that. Has the capacity to help to prevent prostate. But more importantly, your PSA has to be checked. Then your doctor can recommend lines of treatment. But the good news is that it's not everything you have to go into operation. We now have natural medicines that you can use that can stem you from having the prostate. And when it's there, it has the capacity to remove it entirely without any issues. The side effects or the greatest undo of surgery has to do with the dysfunctional infection, the dysfunctional issues that would result from such an operation, to the extent that fertility may come to zero. In fact, the man's manhood coming back to normal, to be able to effect erection and to be able to give dividends of marriage becomes difficult in most operative people. And normally, the 50% chance of even survival is there. So the best way is to go non-operatively, which is what the herbal medicine and the food medicine stands for. If